Hi guys, today we're going to talk about opposing opinions with regards to head injuries and head traumas and why that might be happening. Overall, when it comes to head injuries, one of the things that you have to consider is that every specialist you go see will have a different skill set that was provided to them depending on what their schooling background is. And again, based off of that skill set that they have, they may have undergone additional training to kind of learn more information or more details in terms of how they're going to apply that into their practices. One of the things that we commonly get asked is I went and did an eye test with you, and I went and did an eye test with this other practitioner, and I'm getting different results. Well, the results that you're receiving, although they might seem like they're different, sometimes it's not really the case. One of the things you have to keep in mind is, were we actually testing the same things? Although sometimes we're looking at eye movements, there's a lot of different kind of eye movements, and there's a lot of different things that you can be looking at when you're assessing these types of tests themselves. Are you looking at vertical eye movements? Are you looking at horizontal eye movements? Are you looking at functional aspects of whether the patient can just move their eyes in those planes? Or are you looking at if there's intrusion saccades? Are you looking to see if there's square wave eye movements in them? Are you looking to see if there's nystagmus? Are you looking to see if there's pupillary accommodation failures? So one of the things that a patient might get confused with is, I did an eye exam here, they said my eyes are okay. I did one here and they said they're not. Again, just keep in mind, sometimes practitioners are doing tests that may look similar to yourself, but they actually might be testing very different things. The other thing that we look at too is in terms of balance testing. Well, I did a balance test with one practitioner and I passed, I didn't have any problems with it. Okay, that might be the case. Although when you look at balance as a whole, there's a lot of different things that could be going on with balance. You can have a visual problem making your balance off. You can have a perceptual problem making your balance off. You can have a spinocerebellar issue in terms of just stabilizing agents of your low back. There's quite a few things that could be going wrong that can be causing these balance issues with you. So even though you passed a balance test at one clinic and you failed at another, doesn't necessarily mean they're opposing. Maybe one test was very superficial, whereas the other one looked at things a little bit more in details. So one of the things I always try to emphasize with my patients is when they ask me, is the testing that you're doing different from the test that I'm going to go see here? Because often they don't want to be spending money that they don't have to. And of course that makes sense. Well, the simple answer is it's not that simple to look at. One of the things when we're looking at is, I do a lot of testing that might look similar that a lot of neuro-ophthalmologists or neuro-optometrists are now doing in the city. And for the most part, we look at some things that are very similar, but then the testing as a whole is very different. There are certain specialized tests that they're going to perform that I absolutely cannot. And the same thing goes on my end. There's a lot of tests that I'll perform that they're not performing. So sometimes just because you haven't seen success with one individual practitioner, it doesn't mean that everybody within that field cannot be helpful to you. It just means that maybe that individual didn't have the specialty that was required for your specific condition. So just because you didn't get it once, I mean, try again, okay? There's always someone who knows something different. There's always someone who's going to apply something differently. And that small difference might be the thing that you're looking for or the thing that you need to make the recovery to get you at your next step. Hope that helped, guys. And if you enjoyed, like and follow for more.